a moment to admire the fact that my nails actually match my scrubs today. Did not plan that. Got these done like 4 days ago, and this is the first time I'm realizing that they match my scrubs. Oh, and my toenails match my scrubs. I think this is the matchiest and most pink that I've ever been. So sorry if you guys didn't really want to see my feet, but hey guys, welcome back to my channel. Today's video, as you can tell by the title, is going to be what's in my clinical bag as a nurse. I made a video a little while back about what's in my clinical bag as a nursing student, which I'll link down below in case you guys want to check that out too. But this is kind of an updated what's in my bag. Some of the things that I need as a nurse are different than what I need as a nursing student, especially because I'm not carrying around books or my laptop and stuff, so my bag is full of other essential items at this point. So keep watching if you want to see what's in it. And also partnering with HappyTeeth, which is a brand company, and they made the backpack that I'm using. So keep watching if you want to see all the cool fun details that come along with this bag that I love so much. And let's get into it. Okay, so here's my bag, and I'll talk to you guys about the bag itself in a few minutes, but I'm going to show you guys the contents of the bag first, and then I'll talk about why it's special and why I chose this bag as my clinical bag. So to begin with, hopefully you guys can see really well, it's got an outside compartment. It's got 3 of them, this one on the side, this one on the front, this one on the side, and then I guess it technically has one more in the back here. So let's just go ahead and open this one up first because it's only got one thing in it, and it's my scrub cap. I got a black scrub cap because it just goes with everything. For some reason it makes me feel a little bit like a chef or like somebody that works in a kitchen in a restaurant. But black goes with everything, and especially with COVID, if I had to get floated to COVID land, either to be PPE, so personal protective equipment observer, meaning I help people get their COVID gear on and off, I would wear this up there just for extra protection. And sometimes I've gotten to go back to the OR to see my patient's surgery, which is really cool. I haven't really seen one since I was in nursing school doing my capstone, but if I have downtime, I will go watch the surgery and just kind of see how it went and then come back with the OR team. So anyways, that's why I have this, just in case I ever have to go back to OR or if I go up to COVID land. So this compartment back here is big enough that it will eat my hand. So I can put my laptop back there if I wanted to. But so on this side, there's a pouch for your water bottle, and I've had a really hard time finding a bag that will fit my Yeti water bottle because my Yeti, the base of it is it's small enough to fit into a cup holder, but it gets really big up at the top and it won't fit in my old backpack. This one does. This one fits my whole Yeti in it, which I really love, and I don't have it with me at the moment. I think it's back in my car. And then on this side, I have, there's a pocket right here, but then I keep my pens on the outside right there, and there's a pocket behind it, and then this thing opens up, and I have a granola bar as a snack in here. For some reason I have Cheerios, and then I also keep Tums. So you guys might be thinking, Maddie, you're really young to have acid reflux. Well, the problem is I only get like 30 minutes to eat lunch, and sometimes it's like 10 minutes if my patient's kind of like unstable or the unit's really busy. So I don't get a ton of time to digest it, and it's been causing me a lot of heartburn lately. So anyways, I carry Tums with me, and I will oftentimes offer it to my coworkers too, who are a little bit older than I am and may have more trouble with heartburn than I do. So then back to the front of this bag. I don't know if you guys can see it, but I have a lot of my gear in here. So I've got stuff like my pen light, and then a pair of scissors, hemostats, because I'm always losing them. And then I also have my headphones. So the only reason I have headphones is if I am doing PPE observation. A lot of time goes in between helping people get on and off their gear. So I will sometimes listen to music or a podcast or something while I'm waiting. And then obviously I have my work badge, which I'm not going to show you, and then my paperwork that shows that I had my vaccine, I have a bandana because if I forget a mask for some reason, or I need some extra hair support, like I forgot my headband, I just find like a bandana is really useful in a lot of situations. And then I also have my Fitbit charger in here. So hopefully you guys can see that. That's everything in here. And there's still room, so I'm just boggled by the amount of room that is in this backpack. The next, this is what I think is cool in terms of organization. So I've pulled this part down and there's a divider between my books, if you can see that, and up here. So having this divider has been such a huge help. So I'm just gonna go ahead and show you guys what I have on the very inside of this bag. So that is what it looks like. Everything is so nicely organized. So in the top up here, I have an extra headband that I always bring with me, an extra mask that's reusable, and then I also have my stethoscope. I have my stethoscope, which is the Master Cardiology, and I went ahead and just bought like the fanciest stethoscope that I could find because I graduated and put myself through 4 years of nursing school, so I felt like it was a good investment. And then I also got this cute little name tag for my stethoscope off of Etsy, and I can link down that website down below, but it's got like little mountains on it, and then it's got Maddie on it. I also have my blue light glasses, which you guys saw in my last video, but I have kind of a retro looking pair of glasses here. And that's what they look like. So especially if I had to work a night shift, which I will be working night shifts in a couple months when I'm off of orientation, I will probably use these a lot just so I don't get a headache from staring at the screen, especially when it's dark. And then it obviously has like a little like cleansing wipe in there too. But yeah, so I'm on orientation for 6 months as a GNR, and they orient all of us on days in CVICU because days is when we get our open heart patients out of the OR. So they want to train us really well in that. And then a lot of us will go to nights after that and then get put on a schedule to come back to days if we want to come back to days. And then I have the little pack that came with this bag that was sent to me that says HappyTeeth, and that's the brand, but this is what I keep all my toiletries in. So like my deodorant, my toothbrush, toothpaste, some other feminine products, and that is what's in here. So that was everything that was in this top compartment, and this thing is removable. And then the next things that I have, and this has my hospital name on it, is my huge orientation binder. So it has just my evaluation sheets from my preceptor. I keep other things in it, like a little arrhythmia cheat sheet, and then I have my arrhythmia cards from nursing school that I made. It has my schedule in it. It's got a lot of the common medications that we use in cardiovascular ICU and neurotrauma, which is really helpful. And then it's got a lot of educational sheets and stuff that my preceptors have given me. So this stuff is on CRRT, which is basically a slow form of dialysis for heart patients. And then it has some of my own stuff in here that I made for orientation. So I think I showed you guys this in my first day as a nurse, but I made my own drip titration sheets, and I keep my extra copies in here. And I also made a cardiovascular checklist for open heart patients that I also keep in case my preceptor wants to come check up on me and see what I've done. I can always look at my little checklist that I made and make sure that I've done everything that I need to do for that hour or two. The last thing that I have in here is a suturing kit. And once again, you guys might be thinking, a suturing kit? You're not in med school. You're also not in NP school or PA school. I don't care. I like suturing. I think it's fun. One of the PAs on my unit found out that I want to be an NP one day, and he got me this suturing kit. So it's got this like little piece of fake skin, I guess, to practice on, and then it's got the sutures and some other tools, which are currently in my backpack that you guys saw, and not in this case, but that's the thread and stuff. So anyways, I keep this around because every once in a while, if I have downtime or I see that PA, he'll teach me some new suturing styles. Excuse me. and I'll get to practice. And my hope is to one day go back to school and become an NP, a nurse practitioner. So might as well get some practice now. Plus I just find it fun. So on the other side of the backpack, this is the front of it, I have a giant notebook. So when I'm on the floor and I want to take units about floor specific stuff, I will use this cute little notebook that my fiance's mom got me. And I just keep like random stuff that I learned from nursing school in here, and unit specific notes that I have, such as like managing SVR, so systemic vascular resistance and cardiac output, and just remembering like what the numbers mean and stuff. I keep that written down in here. And then using like the NICOM, which is one of the machines that we use, and just some little pointers and things. So when I'm on my own, I can refer to my notes. Then the next pouch, I have my planner, my little 2021 planner, which I've shown you guys before, but I love this thing. I can basically write in what I'm gonna do on a day-to-day basis. And I think I got this from TJ Maxx. So then I've just got 2 compartments left. I usually will just keep snacks and stuff in here. I'll put like emergency in here, but right now I just have some green tea in it. And then this can also be used for toiletries. So that is everything in this backpack. A little bit about why I chose this, because it is waterproof, and why you guys should totally get it too. So let's talk about this bag for a minute. Hopefully you guys can see it pretty well. It's pretty big. This is not me holding it up to the computer. This is it like right next to me. So it's a pretty good size. It's not too heavy because obviously I don't pack a ton of stuff in it for work. But you guys know me, and although I haven't done a lot of videos yet on minimalism, I am a minimalist. So when I go traveling and want to take my belongings with me, I want to find the easiest way to travel and take the least amount of stuff with me. So usually I'll use a smaller carry-on, but I like using a backpack. And honestly guys, since I've had this, now I really want to go traveling. But this bag is like the perfect size. It's big enough that it will fit like extra pairs of clothes and essentials such as toiletries, but it's also not so big like a carry-on size. I can obviously carry this with me and not hurt my back, but it's not as small as my previous backpack was when I travel. So it's got a lot of great, fun, cool compartments. It is definitely worth its value. There's a ton of room, and this thing is actually removable. So let's say you're packing clothes, and you can either keep your things separated, or you could take this out for a little extra room. And there's an extra pouch in here, which I'll show you in a minute, but look at all this space. I could fit like 4 or 5 pairs of changes of clothes in here. Or if I knew I was doing like a 3-day haul or was spending the night somewhere, or even if I had to work at the COVID unit, I could keep extra changes of scrubs in here. But this pocket is really cool. I didn't realize it until I opened up this side pocket, that when you stick your hand in here, it's actually this big bag right here. So if you needed to keep something separate, like let's say you were putting your toiletries in here, that is the bag. And the best and coolest part about this, in my opinion, is the fact that it's waterproof. And then also it's so easy to wipe down and everything. So why this is helpful for me as a nurse especially is because, or even when I was working as a nurse assistant, I will probably have to put this on the floor somewhere because there's not always a whole lot of room in the break room. Or if I need something by me, like by my charting area, the floors in the hospitals are disgusting. Like obviously they get clean, but just knowing as a nurse what's been on the floor, whether it was like bodily fluids or blood or anything like that, I don't like putting my backpack on it. But in this case, I can put my backpack on it because I can wipe it down with like a sandy wipe. You guys know what those purple wipes are at work that we use to wipe down equipment. It's not bleach wipes. They're like one step below that. But you can actually use those on this to wipe it off. And just thinking in terms of when I was a nursing student and you don't really get a place to put your stuff down, once again, I can put this on the floor without any worries because I can wipe it off. But I worked as a nursing assistant, so there were some times where I would get floated to sit with people. And by floating to sit with people, I mean I got floated to sit with anybody who is potentially on suicide precautions, I needed someone to keep an eye on them, or elderly person who had maybe dementia or some acute confusion, and I had to sit with them to make sure that they didn't fall out of the bed and hurt themselves or pull out their IV out of confusion and also harm themselves. And in that case, I had to sit in the room, and sometimes if I did like a night shift, they're going to be sleeping most of the time, and depending on your hospital's policies, sometimes I would bring a book to read, water, but especially a book, or even like my homework in case the patient was sleeping. And you know, it's 12-hour shifts, you got to find something to do, right? Well, I need to bring it in there, and it needs to be by my side. So once again, even in the patient room, the hospital floor is even dirtier because that's where the procedures happen. That's where the patient may, I'm sorry about this, but throw up or bleed or something unexpected, and those floors are the worst. Even though they get clean, it's still mentally, you know, you never know what's been on the floor, especially if somebody with like contact precautions was in there too. I can take this in there with me, and if you're a sitter or a nursing assistant who had to do the same thing, you can set it on the floor and obviously wipe it off. Or if a procedure happened and something got on the backpack, once again, it's waterproof. Your inside contents are not going to be harmed. Just a shout out to HappyTeeth for partnering with me to make this video possible. But I love their backpack. I highly, highly, highly recommend. It is totally worth its value, and I cannot wait to travel with this backpack. Came in this giant box, and it says "Smile Happy looks good on you," which is so cute. But the backpack actually came in a little bag for like extra protection, so this is what it came in. And this also came in the bag, which is a really cute bag that's also usable. I could easily put my toiletries in here once again, like my deodorant and toothpaste and stuff. But it just came with my receipt, and then a cute little note that says, "You helped create a beautiful and healthy smile." When you buy one of these bags, they actually donate a little dental health kit to somebody who needs it. I think that is so cute. And then they also sent a little thank you note, and then a little sticker, which will probably go on the back of my laptop. This is the little hot cold pack. You can use it for cold or hot, obviously. Sections home with me. But everything in my backpack, guys.